All right, good morning. This is I'm Tom Quigley, and this is Cawfee Talk. You know, I started doing these talks to try and stay connected myself, but also connect with everybody else in the industry. And today I have scheduled Dr. Barry Gordan. Also, will come on the show a little later, Dr. Joseph Rosado and Dr. Kelly King. But to start, Dr. Barry, how are you doing today? How's everything down there in Southwest Florida?
Yeah, hey, Tom. We were just talking a little bit before getting on. Listen, physically, I feel great, and let's hope that stays. And I want to wish everybody, safe self-isolation right now. Let's face it, that's what we've, been asked to do. And I think that is the safest thing to do. We'll talk a lot about it. Physically, I'm great. Mentally, I think I'm, a mess in a lot of ways, like a lot of people. I have some survivor's guilt personally going on because of my 32 years in the emergency medicine business. So I have a lot of friends and colleagues on the front lines. I see what's going on with the PPE situation. I wish I could get a convalescent titer test, which would show that I'd had it and have the antibodies. Believe me, we have so many things to talk about today, Tom, that are obviously COVID-19 related, medical cannabis related. Of course, you see, I'm in the office. So let's just go there. As long as the state is going to maintain the fact that new patients still need to be seen, right, physically. Telehealth has been great. We have about 15 telehealth visits in my office today. But we have 5 new patients as well that need to physically be seen. And the first 2 patients I saw this morning just don't have the technology to do telehealth at home. So there are patients that don't have the computer, don't have the smartphone, need to pay by cash, right? So we do have recertification patients that still want to come in as well. So it's a unique time in the industry.
You touched on something just a few minutes ago, and can you explain to maybe the people that don't know what that blood test is, which could show for, I guess it's an immunity or antibodies? You could probably explain it a lot better than I can.
Right. So when you talk about the testing for the, virus, COVID-19, the acute test, which is the nasal swab, and this is really important. The nasal swab test has to be a very deep specimen, at least into the nasal cavity. So, we don't laugh about it. It's pretty horrible from what it's been explained, but you got to get almost a little bit of brain matter on the swab on the way up there, But it's not just a swabbing of the outside of the nose. Now, there are some newer tests. We got to be very cautious about these new tests. Hi, Joe.
Hey, Barry.
We were talking about testing and COVID-19. So we were just getting into the nasal swab. And of course, the earliest of the nasal swab tests, very deep nasal sinus specimen, got to get up, got to tickle the brain a little bit, pretty uncomfortable. They're touting some of these newer tests that are really more of an external nasal test. And I was saying I'd be very speculative about any test in general, and surely any of the newer tests. You got to be very cautious with results. I know you saw the same studies that I did that said even false negatives many times with an obvious COVID-19 course, they turn positive the next time they do it in a couple, 3, 4 days. Could be sample error, could be not getting up deep enough, could just be the nature of the testing itself. And I know that people are going to try to make money off these charlatanistic garbage tests, no doubt about it. We need to be very careful. What Tom was asking before you got on, Joe, was about the convalescent titer test. And I know you can speak to this probably even a little bit better than I am with the internal medicine background and all that you have. But as I said, my survivor guilt leads me to want to have the convalescent titer test so that if things really get bad here locally in Venice, I would go back into the emergency medicine environment in a second, right? If I knew that I had the convalescent titer test. Hopefully that is going to give good immunity, and that's the slippery nature of the virus. But I know you also would be much more likely to go front lines if you could get, and what that is, Tom, that's a blood test, right? So that is showing the antibodies that are formed after you've been exposed to COVID-19 and have recovered. So your body successfully fought the battle, and now you have antibodies. Very important because the plasma of those patients have antibodies that by research we'll see may be able to substantially assist in the development of a vaccine. and treatment. So even perhaps the serum of somebody who
or infusion
had it may be able to be given to somebody who's at the worst of the viral thing. But that's the point. We're way behind in research.
There's
Joe,
a lot of plasma centers throughout the state of Florida. And what they're discussing is for those individuals that have had the coronavirus but were asymptomatic, is to draw their blood or their plasma rather. And you can do that 3 times a week without being detrimental to you or your health. And then extracting that plasma and then providing that to those that are in greater need or greatest need. The challenge, however, coming from an epidemiological point of view, is that viruses mutate. And so just because I contracted the coronavirus early on and I have immunity, but a new strain may have formed. These are real strains, not like the plants where people say, oh, what strain do you smoke? No, these are real strains because viruses and bacteria do mutate and do create new strains, which is why every year there's a different flu shot, because every year there's a different strain.
Yeah, Tom and I were talking about that, Joe, to the extent that, to me, I think we're all living through what I like to call a Cat 5 hurricane bearing right down on us. But there's a different cone of uncertainty, right? So in a hurricane, there's a wiggle, there's a wobble. Maybe it's going to hit the mountain ranges of Haiti or something and break up. So but not this. There's about 5 or 6 different factors, right? And only one of them is geographical. And as Tom and I were reacting, I think there is a geographical nature to this. I think the larger cities will be harder hit because of a lot of the socioeconomic factors and people living closer together. I think the classic example of New York City. But there are so many
other. It looks like New Orleans is going to kick New York in the butt. I read an article yesterday that they're attributing it to the higher incidence of obesity in New Orleans. And they're linking obesity with a predisposition for the coronavirus. And there was some good data in that article.
Well, that's the interesting thing, Joe. And I think you would agree that the idiosyncratic nature, Tom, of this particular virus is interesting. So at its best, you get a pretty bad flu syndrome and it can last pretty long time, but you don't get the significant lung involvement to it. It's the idiosyncratic, Joe, and I don't know if you've seen any research on this, as who's more prone to get the lung involvement. When you get the lung involvement, it literally eats up lung tissue, creates such a thick layer of mucus that literally if you hit the emergency department with a pulse ox, and you know what, that reminds me, I'm going to grab my office's pulse ox and take it home because I think it's one of the nice things to have at home. Pulse ox is where you put it on your thumb, everybody, and it gives you the oxygen level literally in your bloodstream. If you hit the ER with a pulse ox in the 80s and some degree of chest tightness and shorter breath, and they do a chest x-ray and you have ground glass, they're intubating you in the ER, okay? And then a certain bad percentage of those patients aren't leaving the ER, right? So you see these horror stories of people saying goodbye to their partner at the ER doors. Those are the stories. Now, who gets that, Joe, is interesting. And I don't know that anybody's nailed that down yet. Is it a viral load, for example? So if you're on a cruise ship and you're breathing like virus over and over, or if you're an ER doctor, right, and you're exposed to virus over and over, or an ER tech, you have to look who, but not everybody. So to me, it's like having, Tom, 100 pieces of candy in a candy jar, and you know that 2 of the pieces are going to kill you. If you reach into the jar and pull out, are you going to pull out a couple pieces of candy? So to me, it's that idiosyncratic nature. Also, Joe, who's had it and who hasn't had it yet, right? Is this, and the economic side of it is so significant.
I look more towards the prevention side of it. How is your immune system prior to being exposed?
Absolutely.
Because an ounce of prevention is greater than a pound of cure. And so if your immune system is depressed, if you're not taking or haven't been taking the proper care of yourself, exercising, eating properly, good nutrition, sunlight. I mean, we're fortunate
all that stuff that the ER doctor doesn't do.
Exactly.
Yeah.
None of us do. I mean, I got to take a vitamin D3 supplement because even though I live in the Sunshine State, I'm indoors, and now with the quarantine, stay at home situation, and we're managing a good percentage of our patients via the internet. Thanks to the state of Florida allowing us to do telemedicine with our patients, we're even more indoors than we ever have been. And so I have to force myself to step out into my backyard and get a little bit of sunlight, because, and so to offset that, I have been doing some vitamin D3. I have been taking some antioxidants, vitamin A, vitamin E, vitamin C. I've also been upping my CBD and CBG to, in the morning and throughout the day. I'm doing a good 1-to-1 CBD THC combination to maintain and build my immune system, because we are in the front lines. I may not be an ER doctor right now, but I don't know if in a week or two, because Fauci's talking about this being the worst week ever. So if the possibility occurs that it gets that bad and it's all hands on deck, then my skinny behind is going to be in an ER back like I was back in the day.
You just touched on a few really good things on how to take care of your immune system. What are the top 3 things that you could give people that are at home right now that they can do to boost their immune system during this time?
The main thing is antioxidants. And, those of you that have heard Barry, myself speak from stage or even in interviews, we've always mentioned on the excellent antioxidant properties of CBD, CBG, all the phytocannabinoids. And you can't go wrong with a plant and the whole plant. So obviously, cannabis is our mainstay, and that's what we strongly recommend. But in conjunction with that, the commonly known antioxidant vitamins, vitamin A, vitamin C, vitamin E, okay? If you're having any symptoms, research has shown it's a little questionable. Of course, no one's going to come out and say, no, don't take an anti-inflammatory. But, if you're having any symptoms of joint pain, fever, stick more with the Tylenol, the acetaminophen, rather than the over-the-counter anti-inflammatories, ibuprofen, aspirin, because there has been a link with an enzyme that's found in the lung that this virus interacts with, and it causes an increased production of what's called a cytokine storm. Cytokines are proteins that are pro-inflammatory, cause major inflammation. And so in patients with COVID-19, it's recommended not to use anti-inflammatories or steroids, because the moment you do, for whatever reason, it adds fluid into the lungs, and people literally are drowning in their own fluid in their lungs. So the antioxidants, vitamin A, vitamin C, vitamin E, good phytocannabinoid, and because we're indoors, a good vitamin D3. And those, of course, exercising, I know, Tom, you're working, you got your gym is set up in your garage. A few of my martial arts brothers have set up their dojos in their, living rooms, and they've got their punching bags and everything inside. We're moving, we're doing some type of exercising, some type of working out, because life is motion. And if you're not moving, you're going to lose it. So.
I love that quote right there. Movement is life. And I think it was in a Brad Pitt movie where there was an outbreak very similar, where they were running, and he grabbed the kid and he's like, "Movement is life. We got to keep moving." And it's always stuck in my mind. Doctor, what about traditional things like chicken soup? And I watched the whole thing over this weekend about the 1918 Spanish flu, which didn't originate in Spain, but Spain was the first one to sound the alarm, I learned, and that's why it's called the Spanish flu. But, what about traditional type of
that's a tribal question. I'll let Barry answer that with the Jewish mother making chicken soup.
No, believe me, I love just sitting back and listening to you about all the things that I know. And people laugh at me about this because I'm going down, with the ship with it. I learn every day, and I learn every day from guys like you. I learn every day from my other naturopathic and holistic friends and partners, my partner, Dr. Ald, down in Fort Myers, OBGYN, naturopathic, holistically trained. And there is so much of that. Tom, I say about chicken soup and other such things, just to segue into it. So from the emergency medicine side, people ask me all the time, what should I have at home to be prepared in case I get COVID-19, right? Because, my belief, Joe, is that I think in general, the vast majority of us are going to get exposed over the next year or year and a half or so.
If we haven't been already.
Well, that's the whole convalescent titer thing. I think my daughter in New York City actually had it very early. She was in bed for a week. She works at the Sativa Medical Dispensary in Brooklyn as a, patient care rep or med tender. And she actually was out for an entire week. I would love for her to be able to get the convalescent titer test, both so that her serum, right, could be utilized if need be, and so that she would know that she's been exposed. But Joe, you made a great point earlier about the slippery nature of this virus and how it is mutating so quickly. And that's, I think, one of the reasons that this one has been kicked up in a level of social isolation and with an understanding of how dangerous this particular virus can be, because it comes out of the animal world, right? A novel virus, a different RNA strain, right? Mm-hmm. You and I have been reading the same literature, and I love it. And, to me, if I have to get back into the front lines of emergency medicine, I want to know not to give a aerosol treatment in the ER, for example, because that's actually spreading virus. They're using, believe it or not, Joe, 10 inhalations of an MDI at a time, right? That may equal an MDI aerosol. Let me tell you something else that's scary, is the limited resources of succinylcholine and etomidate and the other things, the vasopressors, that it's not just running out of PPE, it's also running out of those supplies that allow for a safe crash intubation. So I don't want to overscare people about it, but what can you do at home? Have Gatorade at home, everybody, because the key, Joe or Tom, if you talk about chicken soup, sure, there's a lot of good stuff in chicken soup, probably every bit as much as the endocannabinoids that we haven't researched yet in cannabis. So I guarantee you there's stuff in chicken soup that has been and has not been studied that's beneficial. But we know, Joe, for example, that hydration is key when you get a fever, any virus. But Gatorade specifically, or Pedialyte, things of that nature, are going to have you recommend the
Pedialyte. Yeah, I like the Pedialyte better because Gatorade tends to be very rich, very sugary. And if you're a diabetic, and diabetic patients have a predisposition for this virus because it attacks the lungs, the heart, and the kidneys. And the majority of diabetic patients have diabetic nephropathy to an extent. And so it can overwork the kidneys. In an interview I saw with the governor of New York's brother, who's a CNN reporter, he contracted the virus, the coronavirus, Cuomo. And they asked him, what was helping him, what helped him. And he said that his wife was making him chicken soup. And he said, it's an old wives' tale. He said, but that's been my saving grace, eating chicken soup and maintaining a good level of hydration.
You do. And you lose your taste and, your sense of taste and smell, interestingly enough, is one of the symptoms. Not everybody, of course, but, one of the hallmarks of that particular virus. That's why I think my daughter may have had it in New York, because she actually had the chest tightness and she had the low-grade fever and she lost her, sense of taste and smell. But Joe, the point is about the sugar, if you're a non-diabetic, is that your body is generating such a metabolic rate that sugar is very important on replacement. So because your appetite, and your sense of taste and smell is so destroyed, you really need to be forced hydration to that extent. So sure, be cautious if you're a diabetic or other comorbid conditions. Also, yes, the anti-inflammatory thing is key. In my reading also, it seems to be Tylenol that is the best of the antipyretics or anti-fever medicine. Mm-hmm. But importantly also that fever is uncomfortable, and we don't want to have anybody having a seizure from fever or any other complications of fever. But you have to remember that the body's response to virus is the generation of a fever. So in some ways, it is the body's means of fighting it off. So there's a fine line between being comfortable with your fever and not wanting it to spike to 103, 104, but sometimes that low-grade fever. And also you want to stay well hydrated so you keep your lungs. And let's talk cannabis, guys. Yeah. So if you're going to use an inhalation route for cannabis, okay, you better be very, very cautious to the extent that if you know that you're generating more mucus and you're having some degree of lung impairment, this is the time to change your route. This is the time to get away from the vaping or the whole flower vaporization or the smoking of cannabis, right? And go to a tincture, make your own edibles, learn how the topicals and the creams and things, of that nature can help. So far, the good news is, and Joe, we speak to this all the time, the research has always shown that cannabis smoke is not equivalent to tobacco smoke. And we don't seem to get the COPD. We don't seem to get the bronchospasm. In fact, there's probably bronchodilatory effects and anti-inflammatory effects, which are great. Doesn't seem to cause lung cancer. But I think every doctor needs to discuss this honestly, to the extent that surely any degree of lung impairment with COVID-19 infection is going to be disastrous.
I did an interview just last week on the Global Cannabis Town Hall. There were people there from Spain, there were people there from Israel, there were people there from South America, Central America, and this topic obviously came up. And I read an article yesterday that was published in Green Flower Media. Thanks, Tom.
Symptoms, not everybody, of course, but one of the hallmarks of America.
What happened?
yeah, we don't need to hear me again.
I read an article yesterday that was published in Green Flower Media.
Okay.
There we go. Sorry.
We're good? Okay, that was interesting.
Sorry, it's a little small technical.
But I read an article yesterday, and it pretty much parroted what I had said. I've always promoted and advocated vaping the whole plant. I'm not an advocate of combustion or smoking for three reasons. One, and I had discussed this a few years ago with Greg, Dr. Greg Gordan, who, he and I were speaking at an event in Canada. And there's three things that happen when you smoke or you combust. Number one, because of the high amount of heat as you're inhaling, that heat that's inhaled paralyzes the hair-like structures that are found in your trachea called cilia. These oscillate up and down to get rid of any phlegm, any production. Well, by paralyzing them, they are not able to function to get rid of anything that's in your lungs and get it up and out, which is then followed by a cough. And then that leads to bronchitis. It doesn't cause cancer, but it can lead to bronchitis in certain individuals, especially individuals such as myself that have an underlying lung condition. I have COPD. I had childhood asthma, bad allergies, childhood asthma that developed into COPD because of shit I did, at a very young age, in my adolescence and early adulthood. Nonetheless, for that reason, I am an advocate of vaping, of inhaling, because you get the medication within 3 to 10 minutes, as we know. But I recommend using a dry handheld vape, either a tabletop vaporizer or a handheld vaporizer. Specifically the handheld one, because you can control the temperature setting on it. And by controlling the temperature setting, now you can control which phytocannabinoids you can have in your system. So depending on the temperature, remember, THCA and CBDA decarboxylate at 220 degrees Fahrenheit. That's where it becomes CBD and THC. CBGA decarboxylates at 55 degrees Celsius, which is a much lower temperature, which is why CBG is so very hard to come by, and it's extremely expensive because when you have to get at that lower level. But by vaping at a lower temperature, now you're getting more of the acids, and the acids have a greater antioxidant component. And by using that, which is what Dr. Meshulam is leaning towards now, talking about ingesting the acid form, because there's 1,000 to 2,000 times more bioavailability and more affinity for the acid form than the active form. So for this reason, I recommend using a handheld vaporizer that you can control the temperature setting on it. And the lower the temperature setting, the better, because you're able to take advantage of the acid form of the phytocannabinoids.
That
Absolutely. Yeah, for sure. This is why I love listening to, guys like Joe, because I'll be honest with you, I really wasn't aware of that much lower temperature on the CBG. Joe, that's and listen, we're it's such an interesting era right now, and let's just so cannabis practices, Joe. I don't know what's going on with your practice. We found that the newer patients right now, there's been a slowdown, but of course, everybody that's in the program, I mean, this would be a horrible time to lose your cannabis recommendation.
Mhm.
So I know I got a couple new patients, and I may have to hop off in a second, Tom, but I wanted to make sure that this point is really important. And Joe, I know you'd agree. If anybody out there who's a cannabis patient has their recommendation coming up in the next 30 to 60 days and their orders are 210-day state orders are up, you better be contacting your doctor to make sure that you have a plan to get your orders, reinstated. Your doctor needs to be doing telehealth, right? Or still seeing patients physically in the office in order for that to happen. But if you're calling your doctor right now and you're not getting a call back for 3 or 4 days, make sure your doctor's still in practice, right, Joe? We know that. And I worry about the patients that now are looking for their doctors. Their doctors are not currently in practice, and then they're not going to have a chance to recertify unless they see a new doctor in person. One of the vagaries of the telehealth law, Tom, and it's really important, is that you're only allowed to recertify patients that have already been in your practice already. Right. And there's actually, Joe, some subtleties to the extent of whether or not that patient had current 210-day orders, or it could be a guy who hadn't seen you for 300 days or whatever. Because
or a year, year and a half.
Let's face it, financially, some people stock up, they get their medicines, and at the end of the 210 days, their state card is still good, but they don't have the money to come back in and get a recommendation. And I respect that. So my point is, we have been, Tom, I don't know what our viewership is, but if the OMU is watching, and I think every cannabis doctor has taken this attitude, I'm not going to take a patient that hasn't seen me for a year, but was a patient of my practice, who hasn't gone to see another doctor and dropped out of the program, but just hasn't kept up their orders with me. I'm not going to turn that patient back to the black market. I mean, no cannabis doctor that I know of is doing that, but that's one of the vagaries. But the point is that if your doctor's not responsive to you, you better make a plan, because you're going to have to physically go find another doctor. We can't do recertification visits on other doctors' patients. Very important, and I support that. But it does leave a category of patient out there that have not been well served by their doctor, who is no longer in practice, or quite frankly hasn't taken the time to set up telehealth. So I know
that came up during our NMJ
proactive is the point.
Justice League. What we're doing is, we are still seeing new patients because we have to and we choose to. Dr. Gunn, who's my associate doctor, she has been seeing all of my new patients for the past year or so, and so she's doing all new patients, and she's younger than I am. She has no comorbidity, so she can go to the office. But me, the older guy with the COPD, I'm trying to stay away from the office as much as I can just to protect myself. And so I've been managing, because I'm still doing some primary care, so I'm managing the patients, by way of telemedicine.
And then patients love it, right, Joe?
Oh my God, they're so appreciative.
They are.
They're appreciative because we've taken the initiative to protect them from the possibility of them being exposed and infected. Number one. Number two, my typical, primary care patient is, has high blood pressure, has diabetes, has, coronary artery disease, has high cholesterol, has kidney issues. So this is the type of patient that I definitely do not want sitting in a room with, it doesn't matter if there's 8 or 7 other people, 6 feet apart. They don't need to be there. And so they love that. It's very convenient. They don't have to leave work. They don't have to, drive to the office. They're in their backyard. Some guys have called me while they're at work. A few car salesmen are on the lot. They pull off to the side and they're having a conversation with me. Some, contractors, construction workers, electricians, they're calling me from their trucks, so it's very convenient. It's made it very easy. And I'm hoping, and maybe someone from the Board of Medicine is hearing this, I'm hoping that after all of this, is gone, that they continue to implement and allow for a component of the telemedicine. Not only, well, in general medicine, it's been legal since July 1st of last year, but broaden it a little bit more to those physicians and those areas where the patients have to come in on a monthly basis, i.e. your chronic pain clinics, where you have to be seen every month for your, Schedule 2 medication, or for medical cannabis every 210 days. So, I'd like to see a loosening of the reins in the telemedicine arena for certain specialties, certain conditions.
Well, I think that's going to happen. Hang on, Tom. I think it's going to happen, Joe, because this is not going to go away, in a month. So now, and it's important to know, we only have the dispensation till April 15th, right?
Your president said that the country's going to open up by Easter.
I know what he said. Yeah, he also says that everybody should be taking hydrochloroquine and Zithromax, and I don't think he's ever heard of or the prolongation of the QT or any of that type of stuff. Listen, if everybody's going to start taking hydrochloroquine and Zithromax on a regular basis, then there's going to be complications to it. I think it's so irresponsible.
They need that. Your lupus patients, your rheumatoid arthritis, your scleroderma, your mixed connective tissue disorder patients. It's autoimmune patients that need that medicine.
Do you guys think, hold on, I want to go back to what we were talking about real quick about telemedicine. Do you think there's any way we could get the state to do it for the first time patients? Because I'm seeing a ton of people that are coming through my wife's coffee shop that want to get their medical marijuana, because we're all living under trauma right now. This is
all right. Listen, you'll love the story. You'll love the story, Tom. First off, here's my point. I think we're going to get telehealth in cannabis for at least a year. That's not from any insides that I have or any of that, but it happened so early and easily via Governor DeSantis's order, and I was surprised by that I think we're going to have social distancing, quite frankly, for at least a year. And I think all the patients that you were describing, Joe, with the comorbid conditions, immunosuppressed patients, cancer patients, they're going to be advised to lay low and shelter at home for a year, right? And there'll be certain things that'll deemed be essential, but we're not going to be sitting in the NFL football stadium watching our, Browns, okay, with 80,000 people in.
Nobody wants to see the Browns.
Yeah, so my point is, I really do think that we probably will get that dispensation to that extent for a year or so. And Joe, I agree. It'd be a great time to be able to segue into, better care. Tom, I will say this about new patient visits. I'm all about new patient access every way that it can be. But this is what I tell my patients right now. Can you imagine if Governor DeSantis would have opened up the dispensaries to legal adult use 5 days ago and said, oh my God, we are screwed. Everybody go smoke dope, weed, pot, grass, ganja, reefer, dank. We'll reevaluate in 6 months, but the dispensaries are open to everybody. Do you think the dispensaries can grow product for 2 million people in the state of Florida right now? Of course they can't, right? We know that. So I tell my patients, listen, and this is my humble opinion, it's going to be 4 to 5 years before we get to legal adult use in this state. If you're in the program already, that's the right thing to do. And I'm going to tell you a funny story in a second about that. It's the right thing to do because you're getting safe, legal, responsible, educated access to medical cannabis, okay? 330,000 patients have taken that step to do so. They deserve respect. So I'm greedy for my patients, and I'm greedy for myself. I'm greedy for my patients. So to me, I tell my patients, listen, we have zero taxes also for that period of 4 to 5 years while the state decides they're not going to address job protections, nursing home access, state-by-state reciprocity, more qualifying conditions. Joe, you and I could go over the 10 items that Tallahassee is not going to address for the next 4 to 5 years. So you know what? If you want to get in the program, and this is the funny story, I had a very prominent doctor call me, who's not a cannabis recommender yet, but he's very big in the CBD world and believes in it and blah, blah. He goes, Barry, they just opened up the entire medical cannabis program to everybody in the state of Florida. And I said, doctor, that's interesting. What do you mean? He goes, well, everybody's on lockdown now with COVID-19. And they've given everybody a component of PTSD and this and that. Now everybody can come in and just kind of get medical cannabis. And I said, doctor, where the heck you been? I've been practicing that way for 3 years or 3.5 years since I've been doing this, because we're all living in the toxic soup of 2020 or 2017. I call it my new whittling speech. Okay. Unless you're going to, Joe, remember whittling? Tom, I know you do. Unless you're going to teach people in society to whittle, to knit, to quilt, okay, to do all those things that they would do back in the 1880s when cannabis was available as medicine, of course. But when it was taken away by the hypodermic needle invention by Big Pharma and corruption, and then Nixon in 70, okay, reinforced it. We're 50 years since 1970, and we're 40 years since 1980. This doctor will not practice 1980 medicine in 2020. 1980 medicine was Nancy Reagan, just say no. 1980 medicine was cannabis is as bad as all the rest of them. Everybody who's 40 years old now has grown up since 1980 with a cell phone in their pocket. You know what I call this thing, Joe? You'll like it. I like it. I call it the cortisol elevation inducement device. Okay.
Cortisol elevation inducement device.
Cortisol elevation inducement device. Everybody else calls it a cell phone, computer, everything. Ping, ping, ping. Look, this, that, whatever. Everybody who's 40 and under has grown up with that in their pocket almost every day of their life. They've seen school shootings. They've seen Las Vegas shootings. They can't go to a movie without anxiety, okay? Pulse nightclub shooting. They've all lost friends to narcotic overdose. Every single one of a 30 and under is lost. We all have. But that generation, the answer is always several. Or my brother. My kids just lost a friend from, Ohio. 32-year-old kid finally succumbed to heroin after years of abuse. Shut in. I worry about depression and all that going on right now, Joe. What's going on? But the point is, I had to be 20/20 doctor and know that what's been killing people for all these years is narcotics, is tobacco, is alcohol. So society's been too smart for all these years to just say no about cannabis. Now we know why, because it works. And when I came into this, I came into it from a social side of things, right? Because in the ER, I had never intubated anybody, never took care of a husband or wife that beat up their partner over it, never lost a personal friend to cannabis, alcohol, drugs, women, gambling, tobacco, all of them. But now, Joe, you know it works. As medicine, it works. And that's what makes me as fervent as I am right now. We need the mild anxiolytic properties of cannabis to offset alcohol abuse, to offset Ambien, Xanax, Wellbutrin, Prozac, gabapentin, Lyrica, narcotics. They're going to throw all that at society. And I tell my younger patients, they got more years to screw you up. So it's the safe education about every substance that's key right now. So that's my whittling speech. We're not in 1880. We're in 2020, and we need to be 20/20 doctors. And, I just wrote a editorial for the American Journal of Endocannabinoid Medicine on this, because every one of these systemic reviews about the legalization and the consequences and the risks and the benefits and this, it's all tainted by Schedule 1.
Wow. And so many.
My badge, my no research, no peace pin, that I was all ready to get all hashtagged out and everything before COVID, but I got about 100 of them sitting right here.
Wow. I need one of those. So many people are self-medicating right now with alcohol or the medication that they could get their hands on, Valium, Vicodin, whatever they could get. They're feeding their kids more ADHD medicine because they feel like their kids are getting stressed out. And I'm hearing it from parents and neighbors, and you're seeing posts about starting to drink wine at 9 a.m. in the morning because the day is tough, and cannabis.
We're early in this, Tom. We're early in this.
Yeah.
It's still single digits in April. So I'm imploring everybody, if you have friends that are waiting to get into the medical cannabis program, tell them to find somebody and do it now. If you haven't talked to your doctor in a while and your orders are coming up in the next 30 to 45 days, you better be proactive. We don't know what's going to come down. We don't know what's going to be going on 60 days from now. So we're going to try and stay open physically for as long as we can. I tell my staff, and Joe, you know this, we're one test away from being quarantined everybody for 14 days. That's why in my office, we're splitting staff right now. We're having half stay home on certain days and half come in on certain days, right? I can do telehealth at home if I have to for the research, but not new patients. I don't want to get sick. But we're all one test away from a 14-day quarantine and perhaps a very rocky story course. You have to respect this virus. But you also have to respect the medical cannabis program. Tom, I'll tell you, new patients, it's awfully hard to do the teaching. And Joe, I know you would agree with this. For a Doobie 1 or Doobie 2 patient, those that are inexperienced with modern cannabis, it's very difficult to do the teaching that I like to do. I'll tell you one thing that surprised me, Tom. And Joe, you've probably seen this too. You assume the people that come down from the north that have their medical cannabis cards know things because somebody's taught them things. They know shit. Okay, in general. They've had a telehealth visit, a shuck and a jive. They get their card. They go into the dispensary. They have no idea about ratio products. They've never heard of CBG or CBN. Most have heard of CBD somehow, but not from the doctor, right? So I've been shocked at the lack of education that's going on in places where I thought there was reasonable education going on. So I just find it hard to do that level of teaching that I like to have in my clinic via telehealth for new patients. I also fear people writing in on a, let's call it a Trojan horse, so to speak, and really bringing in much lower quality service at a much lower price point for people just to kind of shoot them into the program. So like I said, I'm not so sure that Florida's ready for that right now. And I like the education, that the clinics that do it right offer. That doesn't mean it can't be done by telehealth, but you don't get the same sense. I don't know, Joe.
I have a quick question. Dr. Rosado, maybe you can answer this. We've mentioned this a couple times today, and maybe other people don't know what it is. Can you explain what CBG is?
Sure. CBG is pretty much the mother of the phytocannabinoids. It's the first one that's formed in the plant, and then from CBG, all the others become and form. Now, the advantage of CBG working on the CB2 receptor is that CBD works on, it's a lock and key. Remember, those of you that have heard me say, you've got the key in one hand, you've got the lock in the other, and you're going in, and it causes the reaction to take place. Now, CBD latches onto the lock, not coming in through the front door, but more coming in through the side door. Okay, whereas CBG goes into the CB2 receptor through the front door, allowing it to have more affinity and having a greater effect, which is why CBG is 5 times more potent than CBD as an anti-inflammatory and an antioxidant. So because of the way it latches onto the CB2 receptor, one going more directly in, whereas CBD goes more tangentially, more off to the side. So for that reason, I'm a big advocate of incorporating CBG for multiple conditions, not only for inflammation, but also for patients with Alzheimer's, because it tends to halt better the progression of the formation of the beta amyloid. Hey, Patty.
Hi there.
The beta amyloid plaques and the tau proteins.
Now, can patients ask for CBG when they go into the dispensaries? Are the dispensaries like labeling products that are higher in CBG, to your knowledge?
To my knowledge, no, but Patty could probably tell us because she keeps track of what's going on in all the dispensaries. Do you know of any dispensary that is selling CBG?
Some are not. Some are labeling and putting the CBGs in there, but nobody's selling CBG, just straight CBG.
Yeah, I think one of the great things is the labeling that we're seeing out of the dispensaries is kicked up a notch.
Yeah, I see that as well.
Right. So if you're looking for a specific CBG product, right, you can find those, those cultivars or those, oil preparations, that have a little bit higher amount of the CBG. But, you're right, Tom, giving props to my lovely partner over here. And listen, guys, what a time to have to self-shelter. Thankfully, I have an unbelievable partner that, allows me every day to come home, puts up with my listen, like I said, Tom, you and I were talking off air. I'm going to go see a new patient. And Patty, you can stay on too. The point is, listen, physically, I feel great. Mentally, I'm a wreck in a lot of ways. And Patty knows, coming out of the ER, I got my survivors, regret going on, blah, blah. She's literally, and I won't say what she's going to tie to a rope, not to allow me to go back into the ER environment. Right or left. No, I'm teasing you. But seriously, she knows of my desire to get back in and do and do what you said. And you and I may both have to do that, God forbid if it gets bad, but it surely would be better to do that with the appropriate PPE. And surely would be best to do that with the convalescent titer test.
And an interesting question, and maybe we can find this out from other physicians out there. Have any of your patients tested positive that you know about yet? Or either one of you, or any cannabis patient in the state tested positive?
Not personally. I'm going to go put on my mask and see a new patient. Listen, Dr. King didn't hop on, Tom.
Yeah, she's been in, she's been in
She's working as a hospitalist.
In the hospital. So she's
You're
been
stealing my thunder. The reason she didn't hop on is that she's probably sleeping after a night shift. She sent me a picture all gowned up. And listen, I want to give props to not only Kelly, but those other, I know Dr. Rich Temple is still in the ER environment, Dr. Starsky, there's others that are in the cannabis community that are on the front lines right now working every day. And Kelly specifically, I know as a hospitalist, Joe, is out there in the ICU environment and literally, face to face with COVID patients. So I want to give her a thanks so much and prayers for, good, safe health. I'm going to go ahead and see my patient, guys, put on the mask. Patty can, stay on. And Joe, thanks for all that good info and knowledge. Tom, thanks for including me. I will happily do this every and any Monday or any other day that you want. It's a great service for a lot of patients out there, I'm sure.
Absolutely. Let's do it again next Monday. If you could come back, I still got 15 more minutes. I'll talk with Dr. Joe and Patty if you want to jump on as well. I'm sure you can.
One of my main concerns, and not only for Barry possibly going back into the ER world, but seeing patients here as well, is bringing it home to family. I'm wondering how Kelly's dealing with that per se, or you yourself, Joe.
Well, what I've implemented in my home is when I get home from the office, I pull my car into the garage and I've got a garbage bag by the door. I strip down naked. I've got a Lysol spray. I spray my shoes on the top, bottom, all around, all my scrubs, my towel, everything I put in this black bag, a black garbage bag. I then take that into the house, go into the laundry room straight away and throw my clothes in the washer and start a load right there. Go directly to the bathroom, take a shower, and then I come out and greet, my family members. So that's what I've been doing, coming in from the outside, coming in from the office.
Okay, good.
So,
yes, everybody's doing good.
I'm sorry?
I said everybody's doing well.
Oh, yeah. Everyone's doing well. Thanks for asking.
One other thing, I know we talked about, routes of administration. What about some of these menthol rubs on the chest or CBD topicals on the chest? Doing this, I've seen Vicks Vapor Rub being, for people that are experiencing any symptoms. Is that helpful, or is that something like another old wives' tale?
Well, I could certainly speak to Vicks Vapor Rub, being Puerto Rican, because that's our mainstay. As Hispanics, we love our Vicks Vapor Rub. Any way that you can get the medication into your system is advantageous. So whether it's, sublingual, capsules, edibles, now that they, True Leaf has the oils, the infused oils that people can cook with or use in their salads. So you've got some form of edibles, topicals, patches. But when you use the patches, please use them correctly. Most people stick the patch where it hurts, and it's not where it hurts. It needs to be where there's a blood supply that's running superficially to your skin. So the best places are on the inside aspect of your wrists, on the inside aspect of your arm, on the inside aspect of your ankles, in your groin area, because you've got the femoral artery, femoral vein running right through there. I had one patient that's a bit of a psycho. She put it on her neck by her carotid artery and jugular vein. The problem was that she did had an allergic reaction to the adhesive, and so she had this massive rash on her neck. So I wouldn't recommend putting a patch on your neck, but any of those places, because you have good blood supply going through there and there's better absorption.
Does that also apply for traditional topicals as well, or should those be applied at the point of pain?
Topicals are applied at the point of pain, especially for patients like with rheumatoid arthritis, osteoarthritis, any type of arthritis pain or joint involvement. Applying it directly onto the joint, because the skin has has cannabinoid receptors, but also the joints have cannabinoid receptors as well. So it's absorbed and it works its way into the joint.
Excellent, excellent. Well, I'd like to recap some of the things that we chatted about today, just for the people that may have tuned in late. We talked about building our immune system and how we can keep that strong. Dr. Rosado, can you just review those top 3 suggestions again?
Sure. Of course, start with phytocannabinoids, the whole plant. Do your best to get a good one-to-one or as whole of a plant as you can get. We discussed vaping the dry flower rather than combusting, rather than smoking it, but vaping it, setting the temperature at a lower setting to be able to take advantage of the acid component of the phytocannabinoids. And then over-the-counter supplementation, vitamin A, vitamin C, vitamin E. I know questions are going to come up. What dose? Okay, I'm going to tell you what I do. For vitamin C, I take 1,000 milligrams twice a day. For vitamin E, I take 400 units twice a day. The recommended is 400 daily. I'm doing 800 daily. Vitamin A, I'm doing 10,000 units daily, 1 capsule. Vitamin D3, I'm doing 5,000 units daily. So that's what I'm doing personally on a daily basis to keep my immune system up. Like Barry was talking about hydrating, I have what I do with my Gatorade, because I'm a Gatorade drinker, is I cut it half and half. So I do half Gatorade, half water to cut some of that sugary, that sweetness that is involved. So I just cut it half and half. And I have that in my, big water bottle, and I'm sipping on that throughout the day. And exercising, I'm doing my training, my workouts at home, and every opportunity I can, I step out in my backyard and see, about getting some direct sunlight. The days that I'm in the house, the days that I'm in the office, I'm in that 12 by 12, and that's it.
Joe, what are your thoughts on adding zinc to your repertoire?
I take zinc. I take zinc for my prostate.
Okay.
Because I am 58. Oh, well, gonna be 50. I'm 57. So for my prostate, I take 50 milligrams of zinc at bedtime, together with 4 milligrams of copper to work on my prostate. So yes, I do take the zinc. Some people talk about taking lysine, L-lysine, because it's an amino acid, and it's been known to work as an antiviral. It works very well for viruses. So, that's another option. I've got it here. I'm not taking it, because unless I know I have a viral load or some type of a virus, I don't want to take it to avoid mutating or creating a super virus in my system.
Right. I also want to add some things that I do that I think are important as well is, a wind down strategy for the end of the day. We're starting to watch these news reports around 6 o'clock, 5:30 to 7 o'clock every night. We get our mind racing about, worries. And so I'm starting to, put my phone in my kitchen, turn the ringer off, switch my TV watching to something that's a little bit comedy off of that. And we've started to watch YouTube videos of like the ocean, and there's all these meditation things at night that we can do, because I really believe sleep is a very important piece of everything, and everybody is suffering from sleep deprivation because of worry and anxiety. And things can help you with the sleep, but to develop a wind down strategy for the end of the day as well.
Great.
Yeah, a good meditation. I do that at night, right before bedtime. I take my evening cannabis dose, whether it's the 1 to 9 from Certera or the CBN from our friend Carlos. What's his name? The office, his business, Chillin'.
Yeah, and we have CBG here at my wife's place, Chill Coffee, now as well.
Okay.
Yeah,
but you can get a good CBN product. I know Carlos has it at Chillin'. That helps you sleep because it causes some great somnolence. Or a Granddaddy Purple 9-pound hammer. Any one of the dispensaries has that specific chemo bar. Use that at bedtime. I use the oil, the 1 to 9 oil or CBN, and then right before I go to bed, I use the Iran al-Mog, which is the indica from Vitacan.
Yes, I got the Alaska from Vitacan.
Right, the Alaska is more of a sativa daytime use, but the Iran al-Mog, which is the Tico Nolam product, which, I mean, the word is classic for this time, heal the world. But the Iran al-Mog is their indica, and I use that, 3 1-second inhalations, and then I do an evening meditation. And as halfway through my evening meditation, I'm out drooling, snoring. So
Harvest also has a straight CBN product also.
okay.
I'm sorry.
Harvest.
Oh, wow! I did not know.
I know they're not too many around, but they do have a straight CBN product, and I do believe that they deliver statewide.
That's good to know. And I know a lot of the dispensaries. I know Grow Healthy and Vitacan is starting to list the terpenes, and we could get into terpenes next week. Mm-hmm. But CBN, CBG, looking at some of those profiles, and then kind of creating a strategy, because one of the other things is some people are used to using only one product, and if they're using it more so throughout the day, they may be building up tolerances and increasing their tolerances. So varying the types of products that you use in different parts of the day are very important, especially if you're under extreme anxiety or extreme stress right now.
Yeah, or if you're in the front lines, you need certain protection. So that's why I'm doing the mega dosing on the vitamins, just because of my position in in the community. Going to the office, speaking with sheriffs, speaking with the commissioners, speaking with the vice mayor, speaking with the hospitals.
He's back.
I'm back.
Another thing that I think that we've learned and is that cannabis is an essential business right now. It's amazing that we went from cannabis being an outlier and not being covered in the federal aid that's coming out, unfortunately. But it's an essential business, and it's being seen as such. And I hope that, some of the legislatures see that differently, and we could get some of these rules changed to, help patients down the road. What do you think about that note, Dr. Barrett?
2020, that was my 2020 doctor rant, Tom. I think society is so poorly served by Schedule I designation of cannabis from so many levels, from a public health level, Joe. I'm sure you would agree. I mean, people are too smart these days. I mean, every bit of everything is thrown in their face. All you got, you know what? The best T-shirt going out there right now is the T-shirt with the cannabis leaf that says "My cough's not from coronavirus." Okay, I know, I love that T-shirt. But the point is, that's why I think Schedule I is the one thing that we legitimately, as doctors And I'd like to organize a 10,000 doctor march. I know it can never happen, but a 10,000 doctor march on the steps of the U.S. Congress, because that's what it's going to take. It's going to take the doctor community to say it's immoral, it's illegal to make me practice under your illegitimate idiocy and nonsense. And I just believe that with every ounce of my being right now. And I'm happy to stand up in front of any panel, any jury of my peers, any group of doctors. Joe, we'll knife them to shreds. We're right. And everybody knows we're right. And that's not to say there's not any negative social consequences of cannabis. There's negative social consequences of everything. But nobody's going to ever convince me that the negative social consequences of cannabis are minuscule, both acutely by death at its worst, and also by societal sliding into the couch and eating ice cream and chips all day, amotivational syndrome. Does it exist? Of course it exists. But no one's going to tell me that is going to be solely because of cannabis. It's parenting. It's the innate motivation of the individual himself. I mean, there's way too many factors. I say the same thing about psychosis. I love that. Yep. I say the same thing about psychosis and schizophrenia and all that, Joe. You know that no one can correlate those directly with the research and the studies that we have with cannabis. It's idiocy. And then when you have Ritalin and Vyvanse and Concerta and all these other things that they're throwing at these kids, you know that they're going to cause a higher rate of psychosis than cannabis ever will once the appropriate research is done.
Well, guys, this has been a great hour. Thank you both for taking out time in your busy schedule, to come on. I'd love to do this again next Monday if you guys are available. Like I said, and thank you, Dr. Gordan, for bringing it up. Dr. Kelly's been on the front lines, and many of you know she's my neighbor. She's my local physician here as well, not just for cannabis, but for other things that I'm doing. And I know she's out there every night and working that night shift on the front lines. And hopefully we can get some info from her on what she's seeing at the hospital level as well. But thank you both so much for, helping the patients out there stay connected, helping me stay connected to what's going on. And I think this was a very informative Monday. And be safe. We need you guys. We need all the first line responders, all the medical professionals. If you know anybody out there that's a medical professional or that's out here working, to keep this industry going, or any piece of industry that's still surviving, because we're in a complete shutdown in much of it. But there are some people that are out there still supplying services that are needed by the majority of us. So, thank you guys, and thank everybody else that's still out there pushing away. And I hope that test can come out so we can see that these people that are out there working can work with confidence, that they know either they have an immunity to it or they're safe, so we can get more people out there helping those that need it today.
Well, thanks for setting up this platform to get this message out and to get the education out, because people are locked in at home and they're thinking about all these things that can be going wrong, and hopefully this will be of some benefit and some service to at least one person to understand that what they can do to build themselves up and be stronger and be happier and healthier.
Hey, it's a help to me. I'll tell you that right now. If I'm the one person, so be it. But, my mind goes crazy just like everybody else's. We're all running through scenarios in our minds. And, the thing is to stay focused, bring yourself, stay connected, maybe call a family friend member, FaceTime somebody today that hasn't been able to get out of the house. Our elderly, some of them staying home is a norm, so this isn't a big change for them, but it would be great for them to hear from you. So, if you have a chance, step outside of, your little circle and reach out. It'll make you feel better about yourself as well.
Yeah, I mean, as Floridians, we're, like Barry mentioned earlier, Category 5 coming at us. We know what it's like to go through a hurricane season and a hurricane, but we also know that after 5-7 days, it's gone. And it's going to go up into the Carolinas or go into the golf course, Freudian slip, where I want to be on the golf course, but the Gulf Coast up into Texas, New Orleans, Louisiana, etc. But it's like 24/7 nonstop with Fauci saying, "Oh, this is the worst week ever," and get ready, and So it's even more stressful.
I agree. I couldn't agree more. Keep your family safe. Keep adhering to the CDC guidelines. I know that I'm looking at getting some scarves and some face masks as well for me and my wife, more or less just to help us not touching our faces and, being safe as well. But, again, thank you guys. Let's check in again next week. And my phone's always open, as both of you guys know. I'm always available if either one of us for anything.
Yep, we're all pretty easy to find in this day and age. I tell everybody there's no excuse for nobody not to get back to me at this point either. I mean, stay connected, everybody. That's key, Tom. I love what you had to say, and we're all going to be there pulling on the rope together as we always have.
And we're going to come out stronger. I've said this on my show last week. Every time we've faced adversity or loss as an individual, as a community, or as a nation, we've always come back stronger.
No, for sure. I think, listen, an A-lister, Tom, is going to go down. I don't know who yet, and I'm not praying, believe me, I pray that no A-lister goes down. But knowing this country as I do, I think until a politician of, some, record, or an athlete, or a movie star, or a recording star, that's what changes this country, unfortunately. It's a pretty knee-jerk society. So let's hope, God forbid, it's not a Chris Como or a Boris Johnson or anybody that we know that has COVID right now. But mark my words, in a lot of ways, until an A-lister does go down, I think there's going to be still some degree of softness amongst people that just don't quite accept, how absolutely disastrous this can be when it hits you, your family. It's almost like medical cannabis itself. It's like you're against it until one of your family members needs it. So let's hope that I'm wrong, but I think that until somebody A-list goes down, that it's still going to be a little bit soft.
Yeah, well, I guess Prince Charles just came out of it on the okay side, which is great news. So
But
those
Boris
are positive stories as well.
Boris Johnson had to go into the hospital.
Mm-hmm.
And when I hear about somebody going into the hospital, Tom, as we were talking early on in the hour, there's a percentage of people that go into hospitals that are not coming out, even with the best of care. And listen, I don't want to leave anybody with bad thoughts. Ventilators are only mechanical devices that do the same thing that a hand and an ambu bag connected to oxygen can do. And Joe Rosado, I say to you, God forbid, if anybody needs me to be there and squeeze a bag as a member of a 6 family member entourage that would squeeze a bag for 24 hours until a ventilator's ready for me the next day, right? And that's a horrible thought. That's a horrible thought. And one of the worst parts of this is that people are literally dying alone, not being able to be surrounded by family. So even the capability of having 6 family members there to squeeze that bag for you for 24 hours may not even be able to happen. But let's just hope that we never get to that thought. And once again, I don't want to end a fantastic, positive hour with any thoughts of that nature, but that's why we all need to stay in. The flattening of the curve is really what it's all about. We have to maintain our resources, our hospital resources.
Great. So just again to recap, stay inside, boost your immune system with the things we talked about today, and stay connected and keep your mental health. Have a great week, everybody. Happy Monday. Go and do something to self-enrich yourself today. Bye now.
Thanks, Tom.
Bye-bye. Thanks again.